As a patient comes into the office, perhaps with diabetes, they may be experiencing symptoms such as increased hunger, thirst, and urine. Why this occurs is as we ingest glucose in our diet, our insulin is apparent in type 2 diabetes and trying to let that glucose into the fat cell, or excuse me, into the muscle cells, but the fat cells prevent it from doing so. So the glucose ends up in our blood and just flowing around, increasing an increase of glucose, hyperglycemia. This, as mentioned before, creates that gradient where the water in our cells, there's too much glucose in our blood, and our blood wants to make that a little bit more even. So what it does is it sucks the water out of the cells that it's in and creates a better gradient. What that does is it creates increased pressure on our arteries, increasing hypertension, as well as it creates more water in our blood than in our cells. And that does a couple different things. To increase hunger, because glucose is not able to get into our muscles for our energy, the glucose just remains in our vessels and is not getting in where we need it, so we feel hungry. We're not getting any food. This glucose ends up just traveling through our blood system out with stool or in our urine, and we feel really hungry. We may even lose weight having to do with that. You may see a decrease in weight in diabetic patients. Convert, on the other end of it, water is now being sucked out of our cells where it needs to be and being put into our vessels. Not only is that increasing the pressure inside of our arteries, causing the hypertension, but at the same time, all that urine, all of the water inside of our blood is being noticed by the kidneys, and they want to get rid of that because they regulate our hypertension. So they urinate all that extra water out. So all that extra water leaves and isn't in our cells. So we become really thirsty. We feel like our cells need more water, but at the same time, we're just urinating out of this water. The word diabetes literally means siphon, and it's because all of our water is sucked out of our cells and we urinate it out. So we're always thirsty, we're always hungry, we lose weight because we're not using the glucose that we need. When a patient comes into office, they may be complaining of these things. The physician may order a urine test. You may see glucose or even proteins end up in the urine, depending on how much damage has been done to the kidneys with the diabetes, because what we're about to get into is severe complications of uncontrolled diabetes, which involves kidney damage. Initially, you might see elevated fasting blood glucose level. I'm about to show you a diagnostic chart where if someone has a fasting blood glucose level is above 126, that means to run a more specific test to test for diabetes. The main diagnostic and monitoring and screening test for diabetes is the hemoglobin A1C, and in a diabetic you will have an elevated A1C level. The physician will then order that blood test. The hemoglobin A1C level percentage above 6.5 is indicative of diabetes. What the hemoglobin A1C level is has to do with if more and more glucose is hanging around in our blood, these sticky glucose molecules get stuck to our red blood cells. And now we have red blood cells maybe floating around that are sticky and have glucose molecules attached to them. Every person has a normal amount of sticky red blood cell glucose molecules, but there's a percentage that's healthy. With an elevated, meaning more than 6.5% of the red blood cells are carrying these glycated molecules, are considered hemoglobin A1C. That's not pathological in itself, but it is an indicator of how well diabetes is controlled. The major problem with diabetes is the damage that it does to our circulatory system, because excess glucose over a chronic level lowers our nitric oxide level. Nitric oxide keeps our vessels open, and as we lower nitric oxide levels, our vessels decrease and less oxygen gets to tissues, damaging them. Over long periods of time, that can result in very serious complications, which is one of the reasons why diabetes is such a high risk for other chronic disease.